It has to do most likely with the attachment of the virus to the particular receptor. So this is a receptor that is found on the surface of the human respiratory cells, and in attaching to that receptor, it may again trigger not only infection of the cells and an immune response. And any immune response that we see for any viral infection or bacterial infection can really be attributed in many cases to the immune response that we have. The symptoms can be attributed to our immune response. So for example, when you get a fever, when you have chills, if you have profuse sweating at night or muscle aches, those are actually the result of your immune system that's ramping up and causing this massive human body response to killing this organism. It looks like that immune response has two phases. That is, you have that first phase where you feel sick. Most people report a sore throat, maybe loss of smell that might come back later over time, muscle aches, fever. But then what you see about a week or so later in some people, not all, is that you get this massive response where they can really get a severe respiratory illness, and they can get a massive pneumonia. They can develop a lot of blood clotting in different blood vessels in the body, and can develop other inflammatory responses. There are some other antivirals that we're working on here at Stanford that would also reduce the amount of virus in the body. And the idea there would be, if you reduce the virus in the body, are you also reducing the response over time? So that is, if you can get rid of the virus faster, will that keep that secondary surge of responses from kicking in? Now, the other thing you can do is you can attack the immune response directly. So those are two ways that can be looked at, but those all have to be done in a controlled clinical trial setting. For the individual person, unfortunately, at this point, a lot of this is symptom relief, and obviously making sure people know when they can come into the hospital to be treated. In general, all of these therapies work in a similar fashion, and that is very similar to what you heard about with convalescent plasma. That is, when people get infected and you take their blood and you purify out some of the antibodies in that blood and you infuse that into infected people. The idea there is that you're giving people immunity from somebody else. These may work to suppress the virus. They may work even to suppress the immune response. We don't know that yet.